So to start us off, we have three excellent panelists who have experience in addressing the root causes of homelessness and are leaders in working towards systemic solutions for ending homelessness. I will now welcome to the stage Dr. Andrew Buzari, who is the Executive Director of Social Medicine and Population Health at University Health Network, Leilani Farha, who is the Global Director of The Shift and the former UN Rapporteur on the Right to Housing, and Elizabeth McIsaac, President of Maytree. All right, so to kick us off, this is a question for each of you, but maybe starting with Andrew. What does Ontario's housing affordability crisis look like in your eyes?
Yeah, thank you, Lindsay, and appreciate the opportunity to be on this panel with Leilani and Elizabeth and yourself, and I know doing so much work across the country and internationally on this issue around homelessness, and I think for me really to try to speak to the homelessness and health connection as a practicing primary care physician and fortunate to also be working at the university and University Health Network. In terms of the question about what I see through my eyes, I think the challenge that we're seeing around the affordability crisis and around homelessness and unhoused rates is that it is only getting worse. I think what I saw early, in sort of reflecting in March of 2020, it was with a team that was one of the first groups in the COVID-19 response to do COVID testing in a shelter. And we saw the fundamental disconnect on housing as a human right and this right to physically distance that was denied tens of thousands, hundreds of thousands of people across the country. And that we had seen the efforts to mobilize, again, many of you involved in the room in various leadership levels around ensuring that if people did not have the human right to housing, that they would get access to temporary shelters or temporary hotel spaces. And through my eyes at that time when I felt that the public had seen just how cruel homelessness had been and that I had seen patients and people in tears for the first time being able to access their own bed and shower and ability to cook their own meals, my sense in seeing what I thought everyone was seeing was that we could not go back, that we would understand that we cannot now have people go back into sheltering space. We cannot continue to deny people these aspects. And the literature and the evidence was pretty damning. What we saw around seeing this affordability issue playing out in homelessness is that people who were unhoused were 20 times more likely to be infected with COVID and 5 to 10 times more likely to die. So when we talk about the terminal condition aspect, when we talk about the real gravity, this is what we're seeing. And I think what we're seeing right now is with all of these potential lessons, all of this learning, we are seeing challenges that all of you are facing in various parts of the country that are now worse than what I believe the data is showing. And we're seeing upfront in clinics and shelter spaces than where we were at in 2020.
Elizabeth.
So I think the affordability crisis, we're all aware of it. It touches everyone's life in some degree, either in your immediate or your next circles. If we look at the math, and one of the things that Maytree does is we look at the numbers around welfare, social assistance. That's part of where we dig deep into questions of adequacy in our social safety net. And what we know is that it is not affordable if you are reliant on the social safety net. If you're receiving Ontario Works, and you in this room I think all know what these numbers look like, you come up $17,000 a year short of the poverty line. You come up $10,000 a year short of the deep poverty line. You are receiving, if you are an individual, $733 a month. And then we know what rents are. We're seeing those numbers come out and the math doesn't work. It simply doesn't work. So at $733 a month, you are not able to get the average one bedroom in Hamilton at $1,850, or Windsor or any of them. It's simply unattainable. And so the options of pushing people out of housing are stark. So that's one element of it. That's one indicator. Another indicator is how long people who are living in deep poverty are sitting on waiting lists. The waiting list for affordable social housing in most cities is well over 5 years. It's 8 years to 10 years in cities like Windsor and so forth. Toronto, nobody likes to hear about Toronto, but we're up to 14 years. So that's simply not, the math doesn't work. And so the affordability crisis is acute. Andrew sees it on a daily basis because he's in a downtown hospital and he's on the front line. I would add this editorial comment. I don't think enough of us actually see it. And this whole, we're working from home. Everyone wants to work from home. I don't work from home. I drive through the downtown east side of Toronto every morning, and it's stark that the encampments are there. And not enough of us are on the streets of our city seeing how other members of our community are living or barely living, not surviving. And I think it's a real danger that we have of people living their lives in very secluded, isolated work and home environments. And so I think that's just a contextual piece that we need to be mindful of, because seeing affordability is about being in the community. But it's also the math, and the math doesn't work.
Those are some distressing numbers indeed. Leilani.
Yeah, let me add in here. First of all, thanks for inviting me to the conversation. I'm super happy to be here with all of you and with my colleagues. I think homelessness is probably the most pressing social issue confronting every municipality across this country, and of course in Ontario. What we're seeing is actually quite shocking. Things are deepening, getting far worse, both on the homelessness front, but on the unaffordability front. And of course, there's a deep connection between those two things. We're seeing across the province affordable rents becoming completely unaffordable everywhere. Across Ontario, rents have increased over the last year by about 14%. In some cities, like London, it's much higher. In the last year in London, rents increased by 33%. Elizabeth just spoke about social assistance rates. Rest assured, they did not increase by 33% in the last year, or the last 10 years, or the last 15 years. There isn't a place in Ontario where a minimum wage worker working full-time can afford a one-bedroom apartment. There are cities in Ontario where 99% of the homeless population is Indigenous. Welcome to Ontario, welcome to Canada. I can only say that unless we wrestle this down, we're going to see more conflict and more unhappiness, more woe in our cities. And I don't think any of us can tolerate that.
Leilani, you also have a global view on the issue. How does this jurisdiction, Canada and Ontario, compare to what's happening elsewhere?
Sad truth, global phenomenon for sure. There is, in fact, an unaffordability crisis across the world. Every single city is seeing rents rising much faster than incomes. Incomes generally are stagnant. Maybe we're seeing little increases here and there, but across the world, this is a problem, and homelessness is an acute problem. But I am also seeing across the world more advances than I'm seeing in Canada. And that's a little disheartening. I'll give you an example. I don't know if you know, but Europe is organized as a region, of course, and they actually have a parliament, the European Parliament. And the European Parliament committed as a region to end homelessness by 2030. So that impacts every single member of the European Union. They've all gone back to their domestic jurisdictions and are crafting very concrete, proactive, mission-oriented plans to end homelessness by 2030. It's a tall task, but they've set that for themselves. And I think we can take from that here that that's the kind of approach we're going to need.
Thanks. Well, and AMO's also called on the provincial government to commit to ending chronic homelessness by 2030. So we're hopeful that that we can work with the province on that kind of a solution as well here. Andrew, you've called experiencing homelessness a terminal condition that is a moral imperative to fix. We hear politicians state their agreement that this is a crisis to be solved. So why do we still see people struggling?
Yeah, I mean, I think this is the part that really cuts at all of us doing this work. And I think the fact about what our people or politicians or the political will that is going to be necessary to act on, as Leilani has mentioned, this being the most pressing health and social policy issue. Elizabeth's points about how the data is so damning. And I will add to that in terms of where we talk about this as a terminal condition, we are talking about people who are surviving chronic homelessness living half as long as the general public. And so there is no other vicious policy in that effect that is robbing so many life years. So that is your neighbor having 30 to 40 less birthdays. And when you look at it from a health perspective, there's almost nothing that we can be doing from a prescription of drugs or therapeutics that can ameliorate such a massive divide and disparity. And I think part of it, we also look at more of the data and we talk about the systemic discrimination facing people surviving homelessness, the divisiveness that we're seeing across the country. The city's latest data shows that 60% of people surviving homelessness are Black, Indigenous, or refugee and newcomer. And I don't know for what other populations we would accept such terrible outcomes. I know in the pandemic, we didn't, for a certain degree, when it was about income issues, and we said for years we can't afford basic income to see things mobilized, that it was impossible within a matter of weeks. There was a CREB program. There was needs to ensure that potentially people who were unhoused may pass or transmit the virus in certain neighborhoods. Hotels and shelters were mobilized at mass scale. And now we are watching all of this rip back, as my colleagues have mentioned, seeing all of it now with serious health costs that we cannot undo in the healthcare system. There's nothing we can do in the emergency department or in the hospital ward that will undo the damage and the detriment of homelessness. And so my hope is that we have not seen this action chronically, but because of the advocacy that's here in the room, I think the commitment from many local politicians and councillors and folks across the country who see this and do go out and want to see change and want to see a path forward, that we will see action. Because our record to date, as Leilani and Elizabeth have mentioned, is damning. And I think this is where we try to draw hope in forums like this, of where seeing the realities and seeing that other jurisdictions or other areas can actually see this change is where I hope we can galvanize some traction.
So building a little bit on that answer, Elizabeth, as you know, there's a lot more municipal responsibility on the housing file in Ontario than in any other province or territory. Is this a blessing or a curse?
So for the financial officers in the room, it's a challenge. But I think municipalities are well positioned and the government closest to the people in order to deal with the urgency that Andrew just described. And there is a tremendous urgency. It is life and death. It is about survival. So cities are at the front line. Do they need more revenue tools and options around that? For sure, and that's stuff that can get worked out in the political corridors and needs to get worked out. In the meantime, there are things that can be done that are already within their toolkit, that they can be partners in providing solutions around this. And so I think of things like prevention. Part of what we need to do to stem the flow of homelessness is to prevent people from being pushed into homelessness. Many municipalities provide eviction prevention programs, wraparound services that help people navigate the landlord-tenant process, navigate the emergency benefit options, navigate rent banks where they exist, navigate the other life supports and life stabilization pieces that they may need in order to stay in place. Because people need security of tenure. That's part of the right to housing. They need to be able to stay where they are. They need to be safe where they are. And so programs run by some municipalities like Rent Safe are ways of ensuring that the place where people are is safe, that the building codes are in place, they are safe from fire, they are safe from other elements in their rental space that allows them to live safely. Cities are well positioned to do that. Cities also have a bunch of tools, regulatory tools, bylaws. What are the things that can be used so that we are moving upstream and looking at how we are providing and protecting the supply of deeply affordable housing? There are things like, what are the policies around multi-tenant housing? Is it regularized? Is it regulated? Are the houses safe? Are they being protected from gentrification? Are we ensuring that that part of the supply in our housing market is being protected? That takes work. That doesn't happen accidentally. We have seen this happen in the city of Toronto, and it happens in every city. I know that probably nobody wants to hear about Toronto here, and that's fine. I don't either. But there are things that things like rooming houses, don't let them go into purchase and redevelopment. Where there is redevelopment of more deeply affordable housing, ensure that there is one-for-one replacement of those units. Same size, same capacity, same quality, better quality, same price. Protect the deeply affordable supply. That's within the capacity of the city to do. Things like inclusionary zoning, where you're building more, where the supply is going to be grown. And we know that there's all kinds of tools being offered up for building supply, coming from the province, coming from the feds. The extent to which cities take responsibility to ensure that this part of the housing spectrum, the deeply affordable and the affordable, get their due in the build. That they are building out in that space, that it will be at a level that allows people to live with dignity, who are living on social assistance, who are living on a disability pension or other elements, or minimum wage. As Leilani pointed out, $16.55 is the boost that minimum wage gets in October. That still puts you working 40 hours a week, just over $2,000 a month. And when rents are $2,500 a month, good luck. So we see rent banks oversubscribed and all the other indicators. But what else can the city do? There's lots available there. And so I think for the sake of finding solutions, it's good that the city has responsibility. The city has obligations under some of what Leilani has talked about in terms of the international covenant around the obligation on the right to housing. Cities are obliged. And so step up, but not only make the commitment, but mark the commitment. It's one thing to have intention, and then it has to be played out in measurement, measuring that you're progressing forward, that you're not moving backward. Measure progress made on every indicator so that you are being held to account by yourselves, by your residents, so that you are moving forward. I'll stop there. There's more space.
Thanks. Well, and you've talked a lot about the great tools that municipalities have available to them to be able to start to address some of what we're seeing. Leilani, and then maybe others, what are some examples of policy decisions that have already been taken at various levels that are actually contributing to homelessness?
Me first? No, I think I spoke more recently than you. Okay. So I'm going to take a zoomed out approach to that question and try to go with me on this, because I want to talk about something that we don't talk about enough, and certainly doesn't get talked about enough at the municipal level. But rest assured, you need to know this and you need to kind of digest it. I think we have actually a huge problem with the way in which our economy is structured. Okay, and this is way outside my bandwidth too. I'm a human rights lawyer. I never thought I'd have to get cozy with understanding economics and finance and how our economic system is working. But if we don't get our heads around this, we're never going to solve homelessness. I really firmly believe this, and I've been working in this area for a really long time. In fact, economics is really, really closely related to the human right to housing. So the way our economy is structured in Canada, I call it upside down world. Because Canada is actually, despite the struggles that many people are feeling around affordability, we're a rich nation. We're the 9th largest economy in the world. We moved up a ranking just before the pandemic. Our growth isn't great, and Ontario's growth isn't great, but there is economic growth. So Ontario's economic growth over the last couple of years has been like 1.5%, something in and around there. We're growing. With economic growth, what would we normally expect to see? If I told you a poor African nation had experienced economic growth, what would you expect? You would think, amazing, less people living in poverty, less people living in informal settlements and homelessness and slums. Well, why are we having increasing homelessness in an economy that's maybe not as robust as we might like, but a 1.5% growth? Why is that? That's upside down world. And it gets even more turbulent when you learn that the bulk of that growth, a huge percentage of that growth, is coming from where? The housing industry. Building, renovation, all the real estate transactions. The wealth of this nation, 22% of the wealth of this nation is based in housing. And we have growing homelessness. So I hope you're scratching your head, because we should be all scratching our head, like, what the heck? We live in an economy that accepts as a given speculation in housing, using housing as a pension fund, using housing to grow wealth, using housing to grow wealth of the wealthiest. And until and unless we decide to undo that, to reshape our economy, to envision an economy where human rights outcomes are the return on investment, we're not going to solve homelessness, we're not going to solve unaffordability. So I want you to think, if I can give you one takeaway, right, it's that we need to ensure that all of our investments, all of our public dollar investments, that the return is a human rights outcome. And a human rights outcome is what Andrew and Elizabeth have been talking about, right? People living in dignified housing with enough money to get by. How's that?
So Andrew, from your perspective in the health sector, what are you seeing as some of the examples of policy decisions that are contributing to homelessness?
Yeah, I would fully agree with Leilani, and I'll have my disclosure of not being, from the Chicago School of Economics, but as a physician who does work in health economics, as a researcher, I would have to agree that really what we're talking about, though, fundamentally, is the pathologies of poverty. And I think there's all of this push and shift, and to say, well, is this a mental health issue? Is this an issue that's coming up around addictions? Is this an issue that's coming up because people are lazy, or the onus is on individuals and they don't want to be in housing? This is all bunk. This is all about the pathologies of poverty that are worsening and driving worse health outcomes. People who are living in poverty have worse access to clean air, issues that result in worse respiratory disease and mental health conditions. So we have to be clear, as Elizabeth has said, about going upstream in this analysis as to what's driving these issues and what the actual policy gaps are. So when we look at these issues in terms of housing and homelessness, and we've kept the Ontario Disability Social Assistance at less than $1,200 a month, and the rates of rent that both of my colleagues have spoken to so powerfully, we're stacking the cards against people and then blaming them for bad health outcomes or potentially bad health choices. And we cannot accept that any longer. When we look at this decision, then, Lindsay, about choices. We are choosing as a society or as a government or as a collective to spend $8 to $10 billion on a highway. when tens of thousands of people in my own city do not have access to housing. And when you look at the health costs and the health economics of these decisions, which I promise I get back to stay in my lane, as not a bona fide economist, but as a health economist, when you look at these issues, you'd say, well, it will cost $30,000 a month to have one of my patients in a hospital for a month. It would cost $15,000 to be through the prison system, which a close colleague of mine and mentor, Elena Fredo, was saying the prison system has become the de facto mental health system. It would cost $8,000 from the city's own data, and closer to $7,500 a month, depending on where you are, for shelter, and $3,000 for supportive housing. So really, homelessness is about social justice, but it's sound economics as well. And these policy choices, we can't keep telling ourselves we can't afford better health and well-being and flourishing, as Leilani and Elizabeth have been speaking to.
Great. Elizabeth, anything to add to the question of policy decisions?
This is a tough one to go third on.
I know.
We've covered a lot of the landscape. I think when we talk about what are the policy decisions that create homelessness, I think we have to almost say what are the policy decisions are also what we decide not to do. It's where we decide to be silent. It's where we decide to not change. And so I come back to things like people's capacity for income adequacy. We haven't adjusted the social transfer, the funds that come from the federal government to the provinces. They're not tied with conditionality. They are not tied with outcomes, human rights outcomes, like Leilani has described. The National Housing Strategy, which was a set of policies that included some work on homelessness, and many municipalities were recipients of some of those supports. Robust enough to get to zero homelessness? No, not close enough to being robust enough or going upstream enough. Because we need to get to a point where we have those options in the housing spectrum that people are able to rent. We need to have sufficient social housing. You compare the percentage of social housing that we have in Canada to our colleagues in the OECD or more broadly across, we're lagging far, far, far behind. And that goes deep into the policy assumptions and the architecture that we have at the federal government. The fact that we have by default made home ownership the pension plan of Canada. That's how people save for retirement. They pay off their house. Other countries like Germany and elsewhere, where there's a much more robust pension program in place for everyone, there's less imperative to become homeowners. So where that is the driving imperative, that has the inflationary impact on things. So it's deep in every policy decision, I would say, at every order of government. And as we have the opportunity, we have lots of buzz happening around what's going to come out of the Fall Economic Summit at the federal level. We believe it's going to be a bunch of housing statements. We're hearing stuff come from the provincial government. Until and unless those answers coming from those orders of government will give municipalities and the other orders tools to actually do the right kind of build, put those conditions in place, and ensure that we're building the right kind of housing at a point of affordability that gets people housed and staying housed. So it's a whole bunch. It's hard. What are the policy decisions? They are across the gamut.
Wow, really well said. So Andrew, shifting gears a bit to focus more kind of on this question of mental health and addictions. So an estimated 25 to 50% of those experiencing homelessness live with a mental health or addiction condition. How should that influence our decision makers at all levels?
Yeah, I hope I understand the question right, but I think in hearing it, I think it's clear that there is a bi-directional link. It goes both ways about mental health and homelessness. And I think I would caution on the question and the answer. I think as I was trying to allude to, and maybe I can have a chance to speak more clearly about it with this question, is that you can't cast this as a mental health issue or problem when this is deeply an affordability and pathology of poverty issue. And I think it's hard as clinicians and as people who are working in these spaces where it seems that there is a push now to say, well, these are issues around safe consumption sites, or these are issues around homelessness in terms of the encampments, and this is mental health and addictions issues. And we've seen a lot of that rhetoric in the US, but when you go back to the points my colleagues have made, if you're on social assistance, you cannot afford housing in these cities. The pathologies of poverty drive even worse mental health outcomes. So if you had any genetic predisposition for mental health, try living in a shelter for 6 months and then come back and tell folks how your mental health is doing. So I think it's really important that we talk about the structural violence of homelessness and the impact that it has on mental health. And of course, there are going to be people who have mental health challenges and conditions that are more prone and more likely to be without housing. But all of that being said, in a system or healthcare system where we are one of the only OECD countries that does not have universal pharmacare. So if you are a person who has mental health conditions, we have one of the worst two-tier mental health systems when it comes to accessing a psychiatrist or clinician. So you're denying people access to a health system, you're denying people access to housing, and then you're lamenting potentially, and this is not that you're doing it, but that the public and some of the rhetoric, that this is a mental health issue. And that's the part I think that we have to push back against, both with the data and the real lived stories. And I think what I'm most excited about today is that there's a panel with people who've been pushing on this with lived experience against these notions with very real experiences, but also the compelling stories about how and why and what they're seeing as to how this is happening. And the data is very clear as to who is being pushed into homelessness. And the other element in terms of these choices, I think people have to, and I think Elizabeth said it perfectly about policy decisions are also what we choose not to do. And when we have a situation where we do not have access to universal pharmacare, we have a cost of living crisis around groceries and unprecedented increases in rent. So that means for me is when I'm seeing a patient, they're in an impossible decision between groceries, rent, and medication in one of the richest countries in the world. So I would push back against these laurels of universal health care. People should ask how quickly their loved ones can access for a mental health issue in this country, regardless of where you are. And I would push back against this notion that mental health is the major driver of homelessness. And I think we have to look at with the complexity that we have.
Lindsay, can I just add to that? Thank you so much for that, Andrew. That is so important, and it just so validates experiences I've had talking with homeless people who say they never had a mental health issue until they hit the streets, and it just makes so much sense. I just wanted to raise a couple of other mental health issues that don't get talked about enough. One might be perceived as a little bit controversial, but I'll say it anyway. I've spoken with municipal city staff in cities across this country, and many have expressed to me the trauma they experience having to implement policies that are hostile to homeless people. Policies like moving people along, throwing out their belongings, forcing them into places and spaces they don't want to live. And that is affecting the mental health of the people who should be in positions of assisting and creating dignified options for people. And the other group I wanted to mention are Indigenous peoples who are being compelled into a shelter system often that they say replicates colonial structures, replicates the residential school system for them. And the mental health toll on Indigenous peoples being forced into a system that was not created by them or for them is I just wanted to bring that out because these are things we have to grapple with at city level, I think.
And I do think with our next slate of presenters, I think we'll be able to hear a little bit more in detail from individuals from the lived experience community and from the Indigenous community to be able to get deeper into those really, really important perspectives. So then, sticking with you, Leilani, Are affordability and homelessness issues different in smaller? We have talked a lot about cities, and so many people see homelessness as primarily a big city issue. But are the affordability and homelessness issues different in smaller and mid-sized Ontario compared to urban Ontario?
Well, I think we all know that there's a homelessness problem everywhere, urban, rural. It affects every jurisdiction across the country. There's probably differences in possible solutions, in resource bases, et cetera. So, and I think that's where you're going to see the differences. You will see some differences. I already mentioned, for example, in some cities, depending on the makeup of the population, you'll see obscenely high rates of homelessness amongst Indigenous peoples. There's places in Ontario, for example, Northern Ontario, where 99%, as I said, of the population of the homeless population is Indigenous. Of course, we know there's a disproportionate number of homeless Indigenous peoples who are homeless. That's a given. So, I mean, the general trend is the same, where you're seeing encampments rise up regardless of where you are, big city, small city, rural, urban. But I do think there's some differences in the capacity of certain areas to actually deal with homelessness. And that goes to what Elizabeth was saying about, is it a curse or is it, what was it? A blessing. to be on the front lines of the homelessness challenge. Well, I obviously it's what we're not seeing enough of in the country is intergovernmental and intra-governmental coordination to address the phenomenon of homelessness as it arises in whatever context. And I think that's going to be, I'm hoping that's what's going to come out of the budget in or the fall, whatever it's called. What's it called?
Economic statement.
Thank you, the economic statement. I hope that new relationships will start being formed in this country between different orders of government, across ministries in different governments, and with the private sector as well.
So maybe building on that a little bit, and Elizabeth, maybe asking you to kick us off, what role can volunteer and nonprofit groups play in supporting communities?
So I think volunteer and nonprofit groups are already carrying a really significant role. Civil society has, I think, been at the forefront of a lot of this. If we look at the most recent refugee homelessness crisis that happened in Toronto, where we shamefully had dozens, well over a couple of hundred people on the street having just arrived from Africa. And the city response and the provincial response and the federal response was so delayed that it was communities. It was churches, it was communities, it was the Black-led communities that came forward and found homes to put people in. So I think that there is a robust capacity there. They have a role, but they have to be supported and they need to be working in partnership with governments. And I think many municipalities do have better relationships with a lot of the nonprofits in their communities. In many cases, nonprofits are the service providers for some of the city programs. So I think that that's good because I think communities are closer to the people and they have a better early response capacity than governments do. And so I think that that's important for governments to remember. It's like the early warning system that they need to rely on. It's where they can actually get that input of what people's needs are and to develop a response. What's important is that governments, municipal and other orders, have a capacity to listen and respond to the advice that they get from nonprofits and from communities, so that the wisdom that is at the front line can come up into program design, budget decisions. And I don't know that that's always as responsive as it needs to be. So I think that hugely important role. Just as Leilani said that we need intergovernmental and intragovernmental and bring the private sector in, you also need the voluntary sector and communities as part of that table, as informing decisions and as being the deliverers of some of those answers.
Can I just say one thing too? And I'm sorry, I keep doing this, but
No.
it's supposed to be conversational,
Yeah,
right? So one thing I've noticed in some jurisdictions across at municipalities across the country actually is a kind of distrust sometimes between city and community organizations, civil society, particularly on the homelessness issue. So where organizations come to assist people living in homelessness, particularly homeless encampments, those groups are deemed as political and troublemakers, and a lot of breakdown in communication between cities and those actors who are really just trying to defend I consider them to be human rights defenders. They're defending the human rights of people living in homelessness. And that we have to solve that. We've got to figure that out. Because as Elizabeth said, they're carrying the weight, actually. They're the ones often ensuring that people living in homeless encampments have access to the fundamentals of life. We already know, as Andrew said, the lifespan of someone living in homelessness is cut in half. So these people are really sometimes the lifeline for people living in homeless encampments: water, food, sanitation, drug treatments, et cetera. So I think we really need to rethink that. I mean, I keep talking about rethinking relationships. That's another one I think needs to be rethought.
Thank you. Well, building a bit on that, and this I think it'll be a question for everyone. I think each of you have been involved in trying to find really innovative solutions for what is clearly a very complex problem. Maybe starting with Andrew, what are some of the innovative solutions that you've been working on?
Yeah, thank you. I mean, I think one, and I think you spoke to Lindsay about the panel with lived experience and from communities, and to build on Leilani's point in this, really part of the innovation for us in the healthcare system, which we've not carried a lot of humility, is actually about listening to what communities want and need to thrive and have well-being. And in the hospitals, we have to recognize that we have not been safe spaces for many communities, and I think that came up very acutely during the pandemic, when there was a whole lot of sort of quizzical response as to why, when there were vaccine clinics, for example, that were in hospitals, there were not people coming from marginalized or structurally disadvantaged communities. And then the notion was, well, people don't want the vaccine. Racialized populations don't want the vaccine. And fortunately, and I think to Elizabeth's point, there were Black-led, Indigenous-led communities that stepped and said, no, it's about trust. And being involved with one of the clinics that we had at Tobermory in the northwest of our city at Jane and Finch, there was a vaccine clinic out on a public basketball court that had 3,000 people within 48 hours come through. And you could label that innovation, but what did we do? We listened to what communities were calling for the vaccine, and they were also calling to lead, co-lead, the delivery of the vaccine and of the therapeutic. And so I think part of the work that we have been doing at the University Health Network and at the University of Toronto is to finally listen to what communities have been calling for. And in many neighborhoods, it was not about access, actually, to the emergency department. It was access to housing. So we have, to the discussion about intergovernmental and interinstitutional partnerships, we have partnered with the City of Toronto, the United Way, the Ontario province, and the federal government, and various community agencies to actually launch 51 units later this year of housing with hospital resources. And mind you, I don't believe, and there's always the case of, well, should hospital institutions and healthcare be helping build housing? What would you have us do when we have 200 odd patients, 234 patients to be exact, that make up over 15,000 ED visits a year, because they have nowhere else to go but the emergency department. And so this is, I think, back to the idea of an upstream response, and not us as a hospital trying to do it ourselves. We don't know all that much or very little about housing, and how do you partner to ensure that's happening? And then A more interim solution has been for, I'm sure what cities and towns and municipalities are dealing with right now is around the high rates of alcohol intoxication and drug overdose. And for people who are surviving homelessness, many of us have been at a party where we drink too much. And fortunately, I would hope that Leilani or Elizabeth would call a taxi for me to go home and then embarrass me the next morning. And that is a privilege that many of us have in this room, that we have a place to go. We have friends who can call us a taxi or Uber to get us home safe. For people who are unhoused, the choice is the police or the ambulance if they are drinking or if they're using substances, which many Canadians do. And so we've been able to work with our community partners to set up a stabilization and connection center, which will have ambulances actually bring individuals, if there's not an acute medical need, right to the stabilization site where peer workers, people with lived experience, are actually the ones taking care of them with physician on call, but it's predominantly peer workers and community health workers that are providing those supports, helping them connect them to either various mental health and addiction supports, social supports, and social needs. And currently, we've been in operation for about 7 months now, and there's been over 2,000 hours back to our EMS colleagues or our paramedic colleagues, where a typical drop-off is 3 to 4 hours at an emergency department, and it is now 7.2 minutes at the stabilization center. And that is kudos to the team and staff on the ground. So these are things where we're trying to push some of these interventions.
That's great. Elizabeth, innovative solutions you've been involved with.
So I don't have that. One of the things that we've been thinking about, and we've been trying to message this to the federal government, is as we think about transformational solutions around the housing crisis, what can we actually take to scale to turn this? Because it's hard to turn this thing. It's a powerful engine of all the economic factors that Leilani mentioned, the policy factors that have been mentioned. And so one of the ideas that we've been trying to flesh out is, how do we use public lands? How do we use federal lands, provincial lands, municipal lands as a public asset, not handing them over, not signing over the ownership, keeping it in the government's asset list, keeping it on their balance sheet, but developing it, allowing developers to come in and develop it for social, affordable housing, bringing affordable capital to the project, because we know that capital and land are the two most expensive parts of a pro forma, of developing. And so if we can bring capital at a rate that larger entities like the provincial and federal governments are able to get, bring that to the project, keep the balance sheet, add value to the land by developing it, then it's less investment, it's less spend, more investment, and we're getting the return that we want to see, which is affordable and deeply affordable housing. So I think we have to rethink our assets, rethink how we deploy them, but most importantly, it has to have the conditions attached. Because we know, and I think everyone in this room is more aware of this than I am probably, is that the business model for developers does not yield affordable units. It simply doesn't. We're seeing this come out of the Montreal experience story and so forth. And so in order to make it yield the outcomes we want, we have to bring all of the tools that each order of government has in their toolkit to build out the types of housing that we need, so that there's a place for people to go home, so that there are those options in the spectrum. It's not a done thing. It's an idea that we're trying to get some attention to.
Thanks. And Leilani.
Yeah, it's so funny. I think what Andrew said is right, like innovation, like this is all like no-brainer stuff actually. It's like, how did we get to a place where this becomes innovation? In any event, out of a sense of exasperation with the situation of homeless encampments and how people living in homelessness are being treated across the country, I took it upon myself, my organization, to create a national working group on homeless encampments. Andrew, in fact, sits on that, in that working group, along with the chair and the vice chair, or the president or vice president of the Big City Mayors Caucus. Mayor Savage from Halifax and Mayor Clark from Saskatoon. Indigenous reps, people with frontline experience. There's some academics. It's a broad range, doctors, as I said. And the idea was to come together and figure out if we could write a guidance on how cities should engage homeless encampments. One that is based in human rights and the idea of human dignity and the idea of transitioning the perspective toward homeless people where they're no longer viewed as criminals, encroachers, trespassers, and are instead, or at best, charity cases, and instead are understood as human rights defenders. When they roll out their sleeping bag or pitch a tent, they're making a human rights claim. That's a claim to housing. Yeah. So we've drafted the guidance, and AMO is going to make it available to you. It will be discussed at the next big city mayors convening in the fall.
This is the federal big city.
Yes,
not
sorry.
the Ontario ones.
Yes, the federal, national. The idea is to get this as a national standard across the country. I'll just tell you the 5 main areas. I won't go into them, but you can imagine what they might detail. The first is that cities, municipalities need to solicit provincial and federal government support to address homelessness. And that's that intergovernmental piece we've all talked about. The second, and this is probably the most important, and it goes to Andrew talking about listening. We need municipalities to start meaningfully engaging with people living in homeless encampments and their chosen representatives. And that means listening to them and understanding that they actually have some expertise. They're experts in their own lives, like all of us, and that they do know what's best for themselves. The third area is to explore all viable alternatives to forced relocation or forced eviction. The fourth is that they must be provided with essential services, those services that are so meaningful for life itself. And the fifth is to come up with an encampment safety protocol, one that's fair, one that's not necessarily imposed by the police on the encampment residents, but that rather is a negotiated safety protocol by the encampment residents with the city. So hopefully this will get traction. It'll be socialized. I'm really hoping AMO comes on board. We're going to drag them into the national working group. Yeah, so we'll see.
Wonderful, thanks. And we're really, really excited about that new partnership. As many folks in this room know, we've been working in Ontario with the Ontario Human Rights Commission, kind of on a similar approach tailored for Ontario. So I think that there is so much that we can do when working together. So last question to everyone, and Leilani, might start with you. You've got a room full of municipal leaders, Ontario's best and brightest. What would you tell them about where to start, and what is a kind of a final message you'd like to leave people with?
Oh, I hate these questions. I think I've said everything I need to say. I guess I really love the messaging around all public dollars should have a public return. So any public dollar spent should have a human rights outcome. And I guess I'll just add to that. I think that we're in an era where government officials are going to have to start having very uncomfortable conversations, in particular with the private sector in the area of housing, developers, institutional investors in housing that are gobbling up affordable housing. In the jurisdictions I've met with around the world that are successfully dealing with affordability issues, they are having they tell me we are having uncomfortable conversations with developers. We are strong-arming them into being a real part of the solution around affordability. That's it for me.
Thanks. Well, these folks are used to having hard conversations, so thanks for that. Elizabeth.
I would come back to your description of the room. This is a room full of leaders, so show leadership. And I think that's about owning the issue. There are things that can be done at the city level. I think of the amount of money spent by every municipality on procuring services of one kind or another. Are you requiring that the companies that you're contracting are paying a living wage for their community, more than just a minimum wage, so that they can afford to rent, their workers can afford to rent in that city? Are you using all those tools that you have available to create that affordability context? And you have the power to do that. You're procuring. You also have the power of leadership in finding solutions wherever they may sit. We recently, you may have heard, had an election in Toronto for a new mayor. And when the new mayor was elected, our opinion from Matria was, you've got an opportunity, do the math. There's 1,000 people who are sleeping on the street in tents, 1,000. You've got 25 councillors. Mandate every one of your councillors to find a solution for 40 people in your ward. Break it down. Allow the leaders in your organization to find a variety of solutions. The thing about homelessness and housing is that there's not a silver bullet. There are going to be 100 solutions that are required. And so I think calling and asking people to take leadership and ownership, whether they are mayors, councillors, city managers, directors of housing, directors of EMS, everyone needs to take ownership and find solutions.
Well said. And Andrew?
Yeah, it's always hard to go last on this question as well, Nicole, but I do think that, to build on the points around leadership and the public good, again, recognizing all of the leadership in the room, and I know many of you and all of you have been doing so much around providing life-saving interventions over the last 3 years of the pandemic, and the fact that cities and municipalities are tasked with all of the life-saving and crucial services. And the fact then that we're still hearing federal or provincial jurisdictions saying housing isn't our priority or it's not with the city. And I think really the work that you can continue to do to push back on the notion around the cost of inaction just being far too expensive on a moral and health implication. And I think, as has been mentioned throughout, this intergovernmental approach is going to be so crucial. I think the private sector piece that you'll be taking on or have been taking on. But I think really, to me, I leave this with hope and seeing so much of what we all do now in ways that maybe it was Pollyanna to believe that we were going to pull together in a different way through the pandemic. So really, I leave my trust with you to the kind of action and push on leadership and public good and trust to see us act on the evidence and the lived expertise that you're seeing throughout the day and in your own wards and ridings. So I really, really do leave with hope and encouragement given all of the work to date from cities that I've seen to try to respond to both the pandemic and the real wicked policy of homelessness and health. So thank you.
Thank you so much to our three panelists, Andrew and Elizabeth and Leilani. So we've now just got a very short break to stretch your legs and get some coffee. We'd also encourage you to complete a survey for each session you've attended over the course of the conference. It helps us to get better at bringing you the programming that you're looking for. So the surveys are located in the app for each session, and we'll see you again in 15 minutes.